Hi YouTube and welcome back to my channel. So the last video I made, I said that I would make videos updating progress in terms of my transition. And so since that video, I went to see my gynecologist and we talked about the fact that I want to transition. I wanted kind of her input in terms of where to go and all that stuff. So I saw her. She recommended I go seek therapy first. Apparently that's still a big thing in terms of, and it makes sense, you know, make sure that you really are going in the right direction with where you really want to be, that your head's kind of on straight and that kind of thing. And so she recommended a therapist. I tried to go see that therapist and we just could not make things connect. In fact, when I first talked to her, we had a quickie free 15-minute assessment on the phone, and she kept making excuses about like she's retiring soon and she doesn't have a lot of openings and yada yada yada. So I kind of got the feeling that she was trying not to take on a new client in the first place. And we still made an appointment, and I went to the appointment and it didn't happen. She actually had a sticky note on her door saying that she had to go, had to leave the office suddenly due to illness. And after that, I tried to reconnect with her again and we just weren't connecting. And finally she left me a voicemail and stuff, and she's like, I could try to squeeze you in here. And so in the end I decided that it just wasn't going to work with that particular person. So I went online and did some more research in terms of other gender identity therapists or therapists who take patients for that type of discussion, and found one. And we actually clicked right away. I actually saw her last week and then I had my second appointment today, and we clicked quite well. I felt very comfortable with her. She was very open. She was very accepting of things. She didn't just sit there and stare at me. She actually did, like when I was done speaking, she would continue with more questions and discussion and that kind of thing. So it was a nice give and take. I've had therapy before where the therapist just kind of sits there and stares at you and doesn't prompt you unless you stop talking for a significant amount of time, and I always found that annoying. So this new person was so far has been really great, and we've only had 2 sessions and she's already at the stage where she's like, well, I don't know what else we can talk about. I'll go talk to your doctor and you know, see what else she needs from me. Otherwise, I'm ready to give a recommendation. So, depending on how her conversation with my gynecologist goes, things might proceed from here. Now, I know most people with transition that they do it with an endocrinologist, and I don't know if my gynecologist will just kind of step in and fulfill that role and do it for me, because she does know hormones to a certain degree, but or if she would recommend an endocrinologist for me to go see. Either way, but that's going to be probably the next step, unless my doctor wants the therapist to do some additional evaluation. Other than that, then yeah, the next step will be for me to go, and I'm probably going to have blood work done. They're probably going to have to measure where my current hormone levels are and make an assessment. I'm hoping that I won't need injections. I'm hoping that, because I know the injections can be higher dose, and there's patches and gels that you can use on your skin. It's a lower dose, but it's a more consistent dose of testosterone, and so I'm hoping I can do that. I don't like needles, and getting a regular shot all the time squicks me out really badly, so I'm hoping I can avoid that. Considering I am close to menopause, and my doctor has already talked about, because of the cancer risk and everything, to go ahead and have a hysterectomy and everything once we're, you know, getting to that part of the process. You know, and of course I mentioned that I wanted to do the mastectomy as well. So those are the 2 surgeries that I'm planning on doing going forward once I'm on T. And I'm thinking, from my understanding, from what other people who have transitioned have gone through in terms of FTM, female to male, which is the kind of transition I'm doing, is that they usually go on testosterone first, and then I think it's almost like 6 months to a year later before they have their first surgery, and it's usually the mastectomy comes first, and then any lower surgery after that. And right now, those are the only two surgeries I want, is the hysterectomy. I've been wanting hysterectomy for so long now. I'm pretty sure I mentioned that in my last video. Yes, so wanted hysterectomy, and my doctor's all on board about it now. I'm like, really? Good, okay. The fact that they're on board with me getting a hysterectomy because I want to transition, but back when I was not publicly identifying as male, the idea of giving me a hysterectomy was like, no, we can't do that. You know, what if you change your mind? I'm like, I'm almost in menopause, come on. I'm not gonna change my mind at this point. So anyway, so I just wanted to give this quick little update that, so I've already done kind of the first phase of transition in terms of sitting down, talking to a therapist, and the therapist was like, yeah, you've done your research and you're pretty much, based off of our conversations, because I mentioned how I was very much insistent that I was a boy as a child, and even after I figured out the genitalia difference when I was 4 or 5 or 6 or something, that I still preferred dressing male, and I identified as a tomboy for pretty much all of my life, and everything. So she's like, yeah, you pretty much have all the markers of gender dysphoria. I just, the lucky thing for me is I don't have the crippling depression and anxiety that dysphoria can sometimes trigger in people. I don't have that part, which I've been very lucky. I know a lot of people suffer greatly over that, and I'm grateful that I don't. I haven't had that kind of a problem. It's like, do I want to live as the other gender? Yes, but if I don't get to live as the other gender, is it crippling me? And that's no, it never has. So, but the fact that I'm still having a good chance of being able to do this transition, and just finally feeling more myself in my own skin, if that makes any sense, that's going to be a good thing. So anyway, that is the current update. I think the next update will probably happen after I've had a chance to see whatever doctor I need to see in terms of getting on testosterone, and then starting the documentation process from there. I probably will do monthly updates after that, so first day on TE versus 1 month, 2 months, etc., as a way of documenting both for myself as well as to share with the rest of the world what changes I'm going through, what I'm experiencing. I'm sure the voice, I've heard the voice change is one of the quickest ones to happen, so that'll be interesting. And then, well, we'll see. We'll go from there. So you will see me again at some point in the future. But thanks for watching, and until next time, take care. Bye-bye.